HIV human immunodeficiency virus is a single-stranded RNA retrovirus of the lentivirus family. The virus has two species, HIV-1 which exhibits worldwide distribution and is responsible for majority of the cases, and HIV-2 that predominates in Western Africa with lower risk of transmission and slower disease progression. The human cells targeted by HIV are the CD4 cells. So what is CD4 basically? CD, also known as cluster of differentiation. These are set of molecules that are present on various cells. CD4 is a glycoprotein that acts as a co-receptor for the T cell receptors found on various immune cells including the helper T lymphocytes, macrophages, and dendritic cells. These receptors are recognized by HIV if it enters the body, and HIV then attaches itself to these certain glycoproteins and helps or actually invades the human immune system and attacks various cells. Among these cells, the primary targets are the helper T lymphocytes, while the other CD4 cells affected by HIV are macrophages and the dendritic cells. HIV is an enveloped virus. Within the envelope is viral protein P17 and P18. Embedded in the envelope is a transmembrane glycoprotein GP41, to which is attached surface glycoprotein GP120. These glycoproteins are responsible for attachment to the host cell. GP41 and GP120 act as the primary attachment sites. HIV uses coenzymes CXCR4 and CCR5 for its complete attachment and transmission to the host cell. There are certain people with HIV resistance. Such individuals have mutation for the CXCR4 and CCR5 genes. They remain safe from the further spread of virus within the body, and the virus remains in dormant state. Now, HIV has many ways of evading this resistance. The virus has a high mutation rate and is associated with having many errors while replicating. This is due to the lack of proofreading mechanism of the reverse transcriptase enzyme. Over the years, these errors and mutation helps the virus forms many variants, enabling it to infect various immune cells, hence evade this resistance and state of dormancy. Inside the structure is a viral core or capsid made up of viral protein P24. The capsid encloses two single strands of viral RNA. Apart from the RNA, the core also contains enzymes like reverse transcriptase, protease, and integrase. The cycle starts with the attachment of virus to the host cell using GP120. Second step to the cycle is the attachment with co-receptors CXCR4 or CCR5 for complete entry into the host cell. Within the T cell, virus releases its RNA, and with the help of reverse transcriptase enzyme, the RNA is converted into DNA. This newly formed DNA moves into the host nucleus and integrates into the host DNA with the help of enzyme integrase. This incorporated viral DNA directs the cell to produce cytoplasmic viral RNA and viral proteins. Formed essential proteins and genetic material assemble and are ready to bud off. This is how the cycle continues and various mature virions are ready to infect more CD4 cells. So as we were talking about the life cycle of HIV virus, this graph represents how the virus interacts with the immune cells over a period of time. And this can be divided into three phases: acute, latency, and finally AIDS. Acute phase, the individual is recently infected. The phase ranges over a few weeks and can be divided into two stages. First, the window stage. Here, the patient represents viremia, non-specific symptoms like sore throat, fever, myalgias, etc. The virus cannot be detected by ELISA, and the only confirmatory test at this point is Western blot test. The second stage is the seroconversion stage. Here, non-specific symptoms persist, but now antibodies have developed that are detected by various other tests. Now, coming towards the second and the longest phase of this disease, that is the latency phase. Latency phase ranges over 2 to 10 years or could last longer based on the immune response and good immunity of the patient. It is divided into two stages. Firstly, the asymptomatic stage. Here, there is clinical latency phase where low-level HIV replication takes place predominantly in the lymphoid tissue. Hence, the patient does not exhibit any symptoms. Second is the symptomatic stage. Here, viral load starts to increase and various infections start to take over. Other than that, the patient exhibits night sweats, lymphadenopathy, weight loss. The white cell count ranges over 200 to 800 cells per millimeter cube. For a HIV-infected individual, AIDS is the final stage of the disease. This stage commences when the viral count keeps increasing and the immune system is exhausted to such a point that the white cell count is less than 200 cells per millimeter cube. Opportunistic infections like candidiasis, histoplasma, herpes simplex virus, human papillomavirus, Mycobacterium tuberculosis, Mycobacterium avium, and mucormycosis take over the human body. Oral lesions like Kaposi sarcoma on the palate, non-Hodgkin's lymphoma, necrotizing gingivitis, necrotizing stomatitis, and xerostomia also exhibit. The virus attacks the immune system of the infected individual, making him susceptible to various opportunistic infections, eventually leading to AIDS, which is acquired immunodeficiency syndrome. HIV virus can be transmitted through the infected individual's body fluids, including his blood, semen, vaginal secretions of females, breast milk of the mother, cerebrospinal fluid, amniotic fluid, tears, and urine. Among the main ways of transmission is sexual intercourse between a heterosexual and a homosexual infected individual. Through accidental exposure to blood and blood products like blood transfusion, shared needles, contaminated instruments. Lastly, it could be vertical transmission, that is from mother to the child. It could be transferred to child during pregnancy or during breastfeeding from an infected mother.